San Juan Regional Medical Center, here to meet your urgent and emergent medical needs, whether they are COVID-19 related or not. Medical emergencies happen when you least expect them, whether it's a stroke, heart attack, illness, or injury. San Juan Regional Medical Center's caregivers are here to provide care to you and your loved ones. Find out more online at sanjuanregional.com. Thirteen minutes past 8 o'clock. It is Wednesday morning, September 2nd. Good morning, everyone. I'm Scott Micklin. Thanks for tuning in to KSJE, 90.9 FM over the air here in San Juan County, 103.3 FM if you're listening in the Durango, Colorado area, and of course streaming everywhere from our website, ksje.com. Welcome also to our visual radio listeners and viewers. We're streaming video live, of course, to the KSJE YouTube channel and Facebook page this morning. Our topic today is the upcoming flu season. We'll be talking with my guests from Presbyterian Medical Services. We're also going to be talking about the coronavirus in San Juan County and much, much more. That conversation begins in the next few moments right here on KSJE, so stay tuned for that. Later on this hour, Communications Professor Dr. Mike Hadabaugh will be joining me from the Encouragement Lab. This week, our topic is the new normal. It's that dreaded phrase we don't like talking about. But Dr. Hadabaugh is going to talk about it with me this morning at 8:50 on KSJE. You can listen or watch us at that time. Next hour, it's our classical music program, Roving with the Arts. Mick Hess is taking the reins on that. And today, Mick is featuring music from Igor Stravinsky. That is a special 90-minute version of Roving with the Arts on Wednesdays, of course, because that takes us to 10:30 and our local and regional author program right on Four Corners. Tracy Hales-Vass will be here. She is speaking with this gentleman, author Victor Lone, and his latest book called The 410 Club. You'll hear that conversation coming up today at 10:30 on KSJE. And don't forget, we invite you to follow us on Twitter and Instagram in addition to Facebook and YouTube. And let's check the weather forecast before we get started here with our interview. Sunshine today, a bit warmer, the high 89 degrees in Farmington, clear and 54 overnight. It was a nice cool morning this morning. 93 and sunny tomorrow. It'll be 95 for Friday and Saturday. Still mid-90s on Sunday and Monday, a nice holiday weekend. Overnight lows near 60 degrees and a bit cooler on Tuesday with a high of 82 and mostly sunny skies. Well, let me introduce my guests who are here with me this morning from Presbyterian Medical Services, as I mentioned, and as I always say when I have guests from PMS, I'm a board member of Presbyterian Medical Service, so proud to serve on the board. Tommi Fosnot is here. She is the Director of Nursing here in the Northwest region. Good morning. Thanks for coming in.
Good morning. Thank you for having us.
You bet. Good to see you and have you here. Also joining us here in the studio is Edith McGuire, a nurse practitioner with Presbyterian Medical Services. Good morning to you.
Good morning.
Thank you for coming in as well, and welcome. We were just talking that you were relatively new to the community.
I am. Got here in April. I came from Texas.
Right.
And
we won't hold that against you at all.
So,
welcome.
Well, I'm really enjoying the land of enchantment and being here in the Four Corners area. There are lots of different things to see and do, so I'm having a great time.
Wonderful. And we were saying that it's hot, but it's not Texas hot.
Correct.
So
yeah.
There you go. So welcome. Nice to have you here.
Thank you.
Well, Tommi, let me start with you and talk a little bit about kind of what's been going on with the coronavirus and COVID-19. Of course, I know PMS has been working on testing and those types of things, but kind of give us an update, if you will, from your perspective of how things are going.
Sure, absolutely. I'm actually really excited to say that it seems that things are getting better. We're kind of seeing a light at the end of the tunnel. We have started doing some COVID swabbing testing at PMS. We're going to start doing this every other Thursday starting September 10th. It's open to anyone who feels like they should come and get tested, people that are at higher risk, more comorbidities, diabetes, cardiovascular issues, COPD, like we were talking about. But really anybody is welcome to come and get tested if you're just curious. If you're interested in getting tested, give us a call at the clinic, 327-4796. We'll ask a couple screening questions and then get you registered. We've been doing a drive-through clinic behind PMS itself. You don't have to get out of your vehicle. We're set up under a tent, and the whole entire process itself takes about 30 seconds. So just a short bit out of your morning to come through and get tested. And we're getting tests back in about 3 or 4 days. So it's been a quick process.
Very good. That was going to be my next question,
Yeah.
is how quickly you can get the results. So 3 to 4 days is...
About 3 to 4 days is average right now, yeah.
Right. Very good. And these tests are covered by insurance, or are they no cost, or how do you work
No
that?
cost. Yes, it's no cost, regardless of insurance or no insurance. Well, if you have insurance, we'll get the information, but not to bill you by any means. So yes, it's free of charge to anyone that wants to come through. It is easier if you do call ahead of time and get registered.
Right.
However, we do have a couple extras that if you just happen to forget and want to come by and get tested, we can absolutely get you in.
Sure. And what's your advice for folks about who should get tested? Because I know that is another big question. And early on, there was a concern about maybe the number of tests we had. Now it seems
Sure.
like the supplies have caught up with demand. And so, what would you say for folks who are listening and watching us this morning about who should get tested?
Really anyone at this point can get tested. We do recommend folks that are at higher risk, like I was saying, people that have the underlying health issues, whether that be diabetes or respiratory illnesses, a lot of cardiovascular stuff in this area. But we've tested anywhere from the younger kids have came through. I tested a 5-year-old a couple weeks ago, all the way up to 90-year-olds. So at this point, we're really recommending that anyone at higher risk, in transient population,
Sure.
is definitely a big one right now. So if higher risk patients, people with the chronic issues, really we would really like to see get tested. But this is really open to anybody at this point that's just curious or may have a concern that they've been exposed.
Right. Very good. And I know, again, you mentioned the drive-through way that you have this set up, and I know a lot of our healthcare professionals are getting really good at drive-through stuff, whether
Yeah.
it's
Yeah.
COVID tests or flu shot clinics or other things that have been going on, and telehealth and some of these other things too that I
Correct.
know we're learning a lot about, and you guys are working with, I know.
Yeah. Unfortunately, I don't like the term new normal, but I think I think the drive-through stuff is a new normal for a while now. So
I agree. Very good. Edith McGuire, let me turn to you a little bit about the same kind of topic and about this COVID testing. And, this is something new for all of our healthcare professionals of dealing with this pandemic and what's been going on. And so with your work so far here at PMS, what are you seeing in regards to COVID?
So we don't see a lot of COVID, pre-COVID or active COVID in the clinic because, like every place, we are screening before you come in.
Right.
So, however, I am seeing patients post-COVID, and those people who have serious chronic illnesses, they're coming back and they're having some really hard. What do I want to say?
We've heard about
Yeah.
lingering effects.
Lingering,
Is that
recovering effects, exactly.
right? Yeah.
So people who are now on oxygen, people who are wheelchair bound, people who can't walk across the room without shortness of breath.
And before COVID, they didn't have these issues. Is that what you're saying?
Correct. So that is one of the reasons that we always encourage wearing a mask in public, because it's heartbreaking to see somebody going from being, the normal active person to being wheelchair bound and oxygen dependent.
Right. And that's a great point, I think, and thank you for sharing that, because I think when we see the numbers of COVID cases in our county, in our state, and we certainly mourn all the deaths that we report as well, but even those recoveries, we celebrate those recoveries, but we don't always hear about those other lingering effects, as you say, that even though someone has survived COVID, which is wonderful, it has still done a lot of damage in some cases to their bodies, and they've got things that they have to deal with now for weeks or months after.
Mm-hmm. And some people may be permanently disabled too.
Right. So that's a big
Yeah.
concern. And we're learning more about this. Of course, it's such a new virus that I know medical professionals and doctors and nurses and everybody are learning more about this daily almost.
Right. And so, let me reiterate, nobody likes wearing a mask. It's kind of a pain, but it's important. It's important for your health. It's important for the health of everybody else that you come into contact with, your children, your grandchildren, the grandparents, the people at the retail store. So I highly encourage, as much as you don't like wearing it, continue doing so.
Very good advice, and I appreciate that. So thank you very much. We can't say it too often, and we can't repeat it too often either, so there you go. Tommi Fosnot, let me turn back to you a little bit about, again, working with the clinic at the Farmington Community Health Center, and this is where your testing is happening as well. I know PMS has been doing some other testing corporate-wide out in other, more rural locations. Have you done any of that, or have you just stayed in town?
I have not done any of that. It is correct. We are testing throughout the state at other PMS clinics that we have out there, but my focus has been here at the Farmington Community Health Center.
Got it. Very good. And so again, remind us again the days and times that you're going to be offering these tests again at the clinic.
So our next testing date is going to be September 10th. We're going to start at 7:30 in the morning and run till about 8:30 in the morning, and then from then on out, we're going to do every other Thursday. So I'm sorry, I don't have a calendar in front of me.
That's
so
okay.
September 10th, and then every other Thursday after that, we'll be testing out.
There you go.
On the where.
Looks like the 24th,
Perfect,
and
yeah.
maybe then October 8th, and
exactly, yeah,
Cool.
and we'll start every morning as of right now 7:30 and be running around till about 8:30, I think, depending on the size of our testing day. So.
very good. Well, that's a great service. Again, I know, as we've said, anyone that really thinks they should be tested or wants to get a test for peace of mind, the tests are available from numerous locations, but having it available as drive-through at PMS is a great opportunity as well.
Absolutely, we're here for you.
For folks, so that's great. My guest this morning from Presbyterian Medical Services, we're talking a little bit about the COVID-19 situation here in San Juan County, and also we'll be talking soon about the flu season that is coming up as well. Let's talk numbers for just a moment. As we were saying before we got on the air this morning, San Juan County seems to have really done a great job of getting our numbers under control. Our number of daily cases seems to be low as we look at these every day, and the number of deaths certainly seem to be lower than they were at the peak of this whole thing. And so what does that say to you in your profession?
It really does speak volume that San Juan County has taken this seriously, and they're doing everything that we possibly can to keep ourselves safe, our neighbors safe. I'm really proud of the area that I come from and the actions that everyone around us has taken. I'm excited to finally see numbers start coming down. This is a great thing all the way around. So I hope to continue to see numbers drop,
Right.
even coming into flu season.
And can we draw a connection to maybe masks and doing these social distancing things and all the other things that the medical professionals like yourselves tell us to be doing?
I would like to, yeah. I would like to think that everyone is listening and doing their part in keeping themselves safe and each other safe. I don't know if there's really any other way to chalk up our numbers getting better rather than everyone is doing their part in stopping this spread. So.
Very true. Well,
Yeah.
great. And Edith McGuire, same kind of question with the numbers. This is what you want to see. I know for folks on the front lines, you want to see these numbers down in the community where you're working, I would think.
Absolutely. I think if you look at the nation as a whole, those states that lowered their requirements and got back to, quote, normal more quickly, that their numbers spiked. And in New Mexico, we've been very diligent about opening slowly, about wearing masks in public, from the get-go. And so our numbers have not spiked like other states. So, I mean, kudos to everybody who has worn a mask and who has done their due diligence, your neighbors who aren't going out, and everybody's cooking at home and not going to restaurants and
Right.
things like that.
All those things are helping, right? Or ordering takeout. And
I also think we're very
maybe.
blessed here in New Mexico because we do have we're able to go hiking and walking out in the desert, in the country, without coming in contact with other people. So, as hard as this is, you need to remember how blessed we are because people who live in the big cities don't have that luxury.
That's true. I think about that of friends in Manhattan or even big cities nearby like Denver or Houston or Dallas or Phoenix. They've got open spaces, but they still got a couple more million people to deal with in those places.
And when they're in the park, they have to wear their mask. And I can go walking on a Saturday morning and not come in contact with anybody. And,
There you go.
And so I find that a blessing.
Right. Especially these days. That's true.
Yes.
So there you go. And of course, a big reminder, I think we have Labor Day coming up this weekend, and I know the state folks that we've talked to have always been concerned about the spikes that come after a holiday. We saw it after Memorial Day. We saw it after 4th of July. And so I think folks are cautiously optimistic that with Labor Day, we won't see the spikes in cases because maybe the community has kind of got it figured out that we need to just keep doing what we've been doing, and it will hopefully be a good thing.
I agree. I think, I'm going to see my mother this weekend. So I'm going to take my mask with me. Anytime we're out and about, I will have my mask with me. If I come in contact with anybody else, I'll definitely have my mask on. So if you are with your family, make sure everybody has their mask, and play it safe.
Right. I think that's good. That's good advice. Tommi Fosnot, other words of advice from you?
I think Edie nailed it. We are very lucky in this area. We can get outside and we can still, be with our family, but within safe reason. I think it's important to remember we don't need to pack the restaurants as they start opening up a little bit, and to just slowly ease into this so that we can continue moving forward rather than backwards. So.
Right. Good advice. Very good. Well, let's change gears just a little bit and talk about the upcoming flu season. I know a lot of folks are, again, hopeful that with everybody wearing masks and maybe washing our hands more than we have ever been before, and not touching our faces more than we've ever had been before, that maybe this year's flu season will be a little milder than it has been in the past. But I'm not a doctor, and I don't even look like one or play one on TV. So you guys tell me what you're hearing. Is that what we're expecting, or hard to say?
It's always hard to predict what's going to happen in the flu season, right? So every year I tell every patient, get your flu shot, okay? We can't predict necessarily if the flu shot is going to be 50, 70, 80, 90% effective, okay? And this year we have completely been focused on COVID. We haven't talked about flu. And so it's kind of, been at the back of our minds. But flu season is coming back, okay? Our kids are going to start going back to school, so we'll probably start spreading, all kinds of germs around again, just like we do in a normal year. So get your flu shot.
Right.
Just get your flu shot.
It really does help in a lot of ways, right? Mm-hmm. And I know there'll be some flu shot clinics coming up. They'll be scheduled here very soon, I think. I know PMS always offers flu shots and things like that to your patients and clients and things like that. Tommi Fosnot, again, the flu season, I guess it could be easy to overwhelm our hospitals if we have both flu and COVID patients showing up to our clinics and our hospitals. That's got to be a concern.
It's absolutely a concern. I think everyone is preparing as best as we can at this point. We're stocking up on PPE now that it's a little bit easier to find, and we're making sure that we're going to be able to take every precaution possible to be safe and keep our patients safe. But it's definitely a concern. Some exciting news: we did get our flu shots into PMS. We will start administering those October 1st. We sat down and kind of went back and forth whether to start giving them right away, but per CDC recommendation right now, it's still to start flu vaccinations October 1st, giving our patients coverage over the entire flu season rather than needing them to maybe come back in halfway through to get vaccinated again. So we're like Edie said, we're really going to be pushing the flu vaccine this year. I think every year it's important, but this year will probably be a top priority for people to be vaccinated, just to reduce those numbers, those cases. Right.
And it seems like folks have very strong feelings about flu shots one way or the other. And I imagine both of you hear from patients about flu shots. And what's your advice if they are hesitant to maybe get a flu shot for either themselves or members of their family? What do you tell them?
You don't get the flu from a flu shot. So what it does is it helps you to build immunity to the flu for the upcoming season, And those people who are who are immunocompromised, who have chronic illnesses, are those going to be those people who get the flu and get the worst case flu? Versus I just need to stay home and stay in bed for a few days, okay? So you're talking about people who have any type of heart disease, diabetes, any type of lung problems, kids with asthma or any type of lung problems. Those are the people who should October 1st be getting their flu shots.
Gotcha.
So
very good. Tommi, same advice. What do you tell your patients? Exact
same thing. 9 out of 10 times when people are fairly hesitant about getting a flu vaccine, it's because they do believe that it's giving them the flu and that they're going to get sick. I do remind patients that occasionally after getting the flu vaccine, you might feel kind of cruddy for a day, maybe a low-grade fever, and maybe some body aches, but it should not last more than 24 hours, and that's really not usually the case for many people anyhow. So I think it is important on the education side that we're not giving you the flu, we're helping you build an immunity if you were to come in contact with the flu to minimize the severity of the flu.
Sure. And for those folks who say that, well, I got the flu shot and then the next day I got sick, doesn't it take a while to get into your system and build that immunity? So if that happened, isn't it fair to say that maybe you were sick or getting sick before you got the shot or as you were getting the shot? Isn't there a bit of a delay?
Yeah, so you're talking about people who the next day come up with a fever and then and completely they were probably sick before at the time that they got the shot.
Right, and that's what, because the shot can't really get
because the shot
working
is
that quickly.
The shot
and
is
it doesn't
not going
make you
to
sick.
give you the flu.
Right.
So
there you
yeah.
go. So when they say they got the shot and got sick anyway, it's a timing thing.
Correct.
That's at least how I understand it. So that makes a lot of sense. Well, what should folks know about again the flu season that's coming up and how to prepare again as we've learned since March to distance ourselves, wear our masks, wash our hands. Should that help with flu season this year if we are all doing a better job of staying away from each other and staying cleaner, hopefully, and doing these types of things? What do you think?
Oh, yeah, I think you nailed it. I think social distancing, washing your hands, staying, out of restaurants and staying away from other people who are sick, those are all the things that we should be doing anyway. This year we have certainly we've had to do it more. So, continue doing it. Not only will it reduce your chance of getting COVID, it'll reduce your chance of getting the flu as well.
Very true. Tommi Fosnot, again, add your opinion to this question about what we're talking about. Again, hopefully we have a better flu season, which means not as many patients.
I'm hopeful for that. I think that everyone has become more vigilant with COVID, and we are more careful about washing our hands and what we're touching and not touching our face, and staying away from people that may be sick, or even just quarantining ourselves when we don't feel well. So I am hopeful that this flu season will be slightly more mild than we've seen in the past.
Right. Well, let's all hope so.
Yeah.
Very true. And we just have a couple minutes remaining together this morning, both of you, but I want to ask you, when you see your patients, does it seem like people are paying more attention to their health these days because of all this that's been going on? I imagine they're maybe a bit more concerned about their health if they have to come and see either one of you, but what are you seeing with your patients? Are they taking a more active role, or would you like them to take a more active role in their health?
Yeah, I think everybody is taking a little more active role now. I have people who, because you can't come into the clinic for every single visit, we're doing a lot of telephone calls right now. We're going to start doing some video calls. So people are having to take their own blood pressure at home, and then when we have that telephone visit, that they tell me what their blood pressures are. They're having to log what they're eating and keeping a log of their daily blood sugars, and then we review those things. So it is what they are having to really kind of look, what they used to have to only look at when they came into the office, now they're having to look at every day and go, oh yeah, this is trending, and this is
maybe I shouldn't have eaten that yesterday. Yeah, those types of things. Tommi Fosnot, what about with your patients that you see and the folks you deal with?
I agree with Edie. Some of my concern right now, though, is it does seem like people are still very scared, and so we don't see as many people in the clinic, and I'm kind of worried that people that have some chronic conditions that we otherwise would have seen several times already this year are staying at home and not coming in and not calling because they are so worried about catching COVID. So that is a concern of mine. So I think it's important to remind people that to not be scared, to continue to keep up with your health. I worry when COVID is gone, we're going to see a big spike in worsening other chronic conditions because people kind of put that on a back burner.
Right.
So it's important to remind people that at PMS and hopefully anywhere alike that we're taking all precautions to make sure our patients stay safe, and it's okay to come into the clinic if you need to. It's our utmost priority to make sure that we're clean and we're safe and our patients are healthy.
Sure. Talk to me a little bit about that, because I think maybe folks aren't familiar with maybe the procedure. And so I know in some places maybe you make your appointment and you call, but maybe you stay in your car until you're ready to be seen. You're not sitting in a crowded waiting room. Is that kind of the things that you guys are doing?
Exactly, yeah. So, we do have a couple procedures in place at this point. If you were needing to come into the clinic, you'll be met at the front by one of our PMS employees. You'll get your temperature taken just about like anywhere else you go these days. We'll make sure that you have
like
a mask
Salmon College, like this morning when you
just
came
like
to the
this
radio
morning.
station.
Yeah, absolutely. We'll ask you some screening questions, the questions that people can, say in their sleep at this point. But we screen everybody for any fever or cough or maybe being in contact with someone that's questionable at this point. We get you checked into your appointment, and if you do have your vehicle outside, we'll ask you to wait in your vehicle, and we'll get a hold of you when we're ready to bring you back to your appointment. We're minimizing the amount of people sitting in our lobby. Our pharmacy has been offering a drive-up pharmacy now, so you don't even have to get out of your vehicle to get your medications at this point. And our cleaning procedures are down to a T. We're extremely cautious as far as high-touch areas and patient procedure rooms and everything. So I'm extremely pleased with the way PMS has reacted to this and all of the policies that we've put into place. I feel very safe every day going to work, and I'm confident that our patients are safe coming in to see us as well.
Very good. Well, I appreciate you saying that, and again, I think it's an important message to get out if folks do have these chronic health concerns, that they not just say, well, I'll wait till this is all over and then I can go back and see, because a lot of these things really need to be managed, don't they?
Absolutely.
On a fairly regular basis.
Definitely, yeah, and we can't put our other health concerns out on a back burner and let them worsen and waiting for this to go away. So.
Right. Very good. Well, thank you both for coming in this morning and talking with me about this important stuff as we talk about COVID-19 and the flu season that's coming up. I know folks, as we mentioned, are understandably a little stressed out about what's going on, and we certainly understand that. But again, any advice about mental health for folks just dealing with this stuff every day in the news? I know news folks are just pummeling people with data and information, and again, there's new information every day about what we're learning about this coronavirus. So what would your advice be?
So we do have counselors who specialize in talk therapy, and we also have psychiatric nurse practitioners and physicians in our clinic. So if you are struggling with anxiety, depression, insomnia, and there is a lot of that going around, especially around because of the pandemic, don't hesitate to call us. Let's make an appointment. Some talk therapy can go a long way. They can give you some tools to use to help you get through a day or a specific situation. If you need more, you feel like maybe you need to get on some medication or something like that, we'll get you hooked up with one of our psychiatric nurse practitioners and get you on the road to wellness.
Very good. Well, great advice. And Tommi Fosnot, again, I know about all the mental health and behavioral health services that PMS offers, but it's a great kind of one-stop place if folks have multiple concerns.
Absolutely. Yeah, we're that's the really unique thing about Presbyterian is we're able to hit healthcare in almost every single direction, and so we are unfortunately seeing a spike in people stressed out and depression and a lot of the addiction issues and stuff. And so yes, I think it's important that people know that we are here for you and offer a lot of those services and counseling at Presbyterian.
Very good. Well, before we go, one more time, if folks want to contact the Farmington Community Health Center or find out or make an appointment, the phone number, how should they go about doing that?
Absolutely. Give us a call, 505-327-4796.
There you go. Very good. Thank you both for coming in this morning with great information. Appreciate it.
Thank you for having us.
You're very welcome. My guest this morning, everyone, from Presbyterian Medical Services, right here on KSJE. Back with more in just a moment, everybody. The time right now is coming up on 8:40.
Autonomous cars could be a lifeline for people with disabilities. Once the industry